Welcome to a presentation about Wilson's disease brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Wilson's disease is like a car that has a faulty fuel filter. The fuel filter is responsible for filtering out impurities from the fuel before it enters the engine. In Wilson's disease, the liver is like the fuel filter. It is responsible for filtering out impurities from the blood before it enters the rest of the body. However, in Wilson's disease, there is a defect in this filter which causes copper to build up in the body instead of being filtered out. This buildup of copper can cause serious health problems if left untreated. Wilson's disease is a rare genetic disorder that affects the body's ability to process copper. Symptoms of this condition can vary, but typically include abnormal liver function, including jaundice, fatigue, and abdominal pain. Neurological symptoms such as tremors, difficulty speaking or swallowing, and muscle rigidity. Behavioral changes such as depression or irritability. Kidney problems such as protein in the urine or swelling in the legs. Changes in skin color, including a bronze tint to the skin. Changes in eye color, including a yellowish tint to the whites of the eyes. Wilson's disease is a rare genetic disorder that affects approximately 1 in 30,000 people worldwide. It is more common in certain populations, such as those of Mediterranean, Middle Eastern, and Ashkenazi Jewish descent. It affects both males and females equally. The disorder is usually diagnosed in childhood or adolescence, but it can also be diagnosed in adulthood. Wilson's disease is caused by a genetic mutation in the ATP7B gene. This gene is responsible for producing a protein that helps to regulate copper levels in the body. When this gene is mutated, it causes an excess of copper to build up in the body, leading to Wilson's disease. This mutation is usually inherited from one or both parents, although it can also occur spontaneously. Treatment for Wilson's disease typically involves medications to reduce the amount of copper in the body, as well as lifestyle changes. Medications such as penicillamine, trimethoprim, and zinc acetate are commonly used to reduce copper levels in the body. These medications work by binding to copper and helping it be excreted from the body in urine or stool. In addition, a low-copper diet may be recommended to help reduce copper levels in the body. This includes avoiding foods high in copper such as shellfish, nuts, chocolate, mushrooms, and organ meats. It is also important to avoid multivitamins that contain copper. Finally, regular monitoring of liver function tests is recommended to ensure that treatment is effective and that any complications are caught early. The prognosis of Wilson's disease is generally good if it is diagnosed and treated early. With proper treatment, most people with Wilson's disease can expect to live a normal lifespan. However, if the disease is not diagnosed and treated early, it can lead to serious complications such as liver failure, kidney failure, or neurological problems. It is important to follow your doctor's instructions for treatment and monitoring of the disease in order to ensure the best possible outcome. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinali.com/info. Be safe. Love you.